everyone, and welcome back to another episode of Sisterly. You're here with your co-hosts, Rebecca and Olivia, and we're so excited to be back with you. Happy International Women's Day.
We love women.
We do love women. And in celebration of International Women's Day and the fact that it's Women's History Month, we thought it would be very appropriate to make today's episode about women's health. So we have a very special guest today, my good friend Laura, and she is here to talk with us about women's health and women's health issues.
Yes, she is a nurse practitioner, and she's amazing. We actually just chatted with her. We had a wonderful conversation about all things women's health. We focus more on, so when you go to like a women's health clinic, a lot of time they do like obstetrics and gynecology, and we focused a lot more on like the gynecology portion today. But we could talk about women's health all day. So hopefully we can talk with her again. But we're so excited to have you back for another episode. And I feel like I'm buzzing because we just had a great conversation. I feel like I'm talking fast. I also am buzzing because I'm hungry. It's a different type of buzz.
That's interesting because I feel like when I get hungry, I get low energy and quiet.
I get jittery.
Oh, I get hangry.
Oh, I mean, I get hangry too. That's real. Jack and I were actually talking about this. We went on a hike yesterday and we ended up starting a little bit later than we planned on it. And so I was hungry, and luckily he had like a backup Cliff Bar, and he was just saying like he should be more prepared these days, like for food for me. Like he should carry like a granola bar with him at all times in case I start getting hangry.
I will like bring a granola bar out with me to like where we're going out for the evening. Like we're going to a bar, like I'll bring a granola bar. I'm like, if I get hungry, it's over.
I used to do that when I was in school. Like I always had a snack in my backpack, and I maybe I'll do that when I start going back into the office. I literally do it
because like we'll go out and like Michael will like laugh. He'll be like, "Did you bring a granola bar?" I'm like, "Yes," and he's like, "Good call, good call." Yeah, because he knows like the night is over if I get hangry.
Yeah, no, it's not pleasant. Luckily, I'm not in like a hangry stage yet, so we're good. But we hope everyone had a great weekend, is having a great week. We are finishing up our weekends as we record. I had kind of a busy weekend, not like anything crazy, but like I went to a concert on Friday. I went to a concert to see this band called Valley, which if you have not heard of them, I highly suggest.
I think I've heard of the name, but I don't think I know their music.
You actually probably saw them because we both saw Len and Stella in concert and they opened for her.
Oh my God, you're so right. I did.
Yeah. And they're really good. So I forgot that I saw them in concert. And then they have a song that's in the movie Booksmart. And I was listening to the soundtrack and I heard one of their songs and I was super into it. And then Jack and I just started listening to more of their music. And then we remembered that we saw them open for Len and Stella.
That's so wild. I need to go back to my photos and videos now because I definitely did.
Yeah. And they're really good. We saw them in San Francisco. Yeah. And then on Saturday, I like went for a hike, and then with friends, which was lovely. That's when I was a little hungry. And then Jack and I went and saw the new Batman movie last night. The Batman, which I don't know how I feel about that title. I don't know why I don't like it. The Batman.
It feels like funny to me.
It
I
does,
like find it funny.
Like
it gives me a little giggle every time I say it, like the Batman.
Listen, I really want to know what other people's opinions are if they saw it. So please DM us if you did. I didn't love it.
I haven't seen it, and I probably won't, to be honest. But I just find Robert Pattinson to be a very intriguing person where I feel like I can't tell if he's like highly socially anxious, but at the same time, kind of an egomaniac. Like I can't.
Yes, I agree.
You know what I mean?
Like he seems a little cocky.
Right. I think he's cocky, but also deeply anxious and like deeply self-deprecating, but also like I can't figure him out.
He gives off like Jesse Eisenberg vibes.
Yeah, I'm like, what is your vibe? I find him so.
I totally agree with that.
Because I also saw like a clip of him and Zoe Kravitz like promoting the movie, and someone said to him like, "Did you know that like scientists like did this study and found you to be like the most attractive person or something, or like most attractive something."
Such a weird statement.
It was a weird statement, but like Robert Pattinson, like, made, like, kind of a face, and Zoe Kravitz was like, "Yes, he's aware of the study. I've heard of it," or whatever, which made it sound like he, like, knows
That's
it
so funny.
and, like, thinks it's kind of funny, but also, like, tells people that, and I was just like, "He just seems like a conundrum. I can't figure him out."
Yeah, it was interesting. I felt like I was analyzing him a lot during this movie. Like, I don't know if I find Robert Pattinson attractive or not. Like, I really
Right.
can't tell. I think when he played Edward Cullen, I don't think I found him attractive.
Right. Well, it was just like we really liked the character and we were obsessed with the story, but if you're, like, literally thinking about, like, attractiveness, I
I
don't
don't
think
know.
so.
I feel like objectively he is, but like in my perspective, I don't see it. But
But
I,
his personality also just seems so weird that I, like,
yeah,
can't get beyond it.
I agree. And also, it was interesting too because anyone who is in our generation knows him as Edward Cullen from Twilight. Like,
Right.
I was like, it's funny watching Edward Cullen play Batman. And
Right.
it was just interesting because in Twilight, he's kind of like lanky. Like, he's not
Yeah,
necessarily very like
like,
muscular.
jacked.
He
Yeah.
They definitely had him like
Bulk
put
up for the
on
movie.
muscle for this movie,
Yeah.
which was kind of interesting to see. There were a lot of shots of his back, like, with no shirt on, and I was like, "What's with this?" They also did like, had this whole scene of him basically building, like, your typical, like, trying to figure out, like, who is the murderer, like, wall,
Oh,
like,
yeah, 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 yeah,
with
yeah.
no shirt on, and I was like, "This is
This is a little
interesting."
bit gratuitous, but okay.
Yeah. I don't know, I just
I don't know if I'm gonna see it. I just feel like
it was
this is maybe a
so
controversial
long.
take, but I'm just more of a Marvel gal myself,
I'm
and
also 100% more of a Marvel gal, not a huge Batman fan in general. I
I feel
always
like
forget
DC
how
can just
dark
be
it is. It's
so dark.
so dark,
Yeah.
and in a
I'm like,
way
I'm
that
here for Wonder Woman, but for Batman, I don't know.
it's dark in a way that I just don't find entertaining. I know some people do, I don't. The whole movie was also, like, dark literally, like,
Literally,
hard
yeah.
to see, dark movie, raining all the time. It was also very dramatic. It was 2 hours and 56 minutes, people.
That's just
It was
that's
so
too long.
long. It was so long and not in a way that made sense, in a way that they should have wrapped it up so much sooner. So much
Yeah.
sooner.
It's a long
I
movie.
also love Zoe Kravitz, but I didn't love her in this movie, which was a bummer. I think it might have
Yeah.
been the writing. I felt that everything was a little bit too dramatic, like, even for
Yeah.
Batman.
I mean, 'cause she
Um,
is good in other things.
Also, the lead detective in this movie was Beetee from The Hunger Games. But yeah, anywho, I don't think I could recommend it unless you're really, like, a big fan of DC. Marvel's better,
Yeah.
so I'll
Go
stand
see
by it.
Spider-Man: No Way Home again.
Seriously. Also, not to bring up Euphoria again, like, I'm really sorry, I don't know what to say because I can't stop bringing up Euphoria on this podcast, but I was actually just listening to another podcast where they talked a lot about Euphoria, and I wanted to just give an update for our listeners who also watch Euphoria. Apparently, is it Ferreira? Is that her last name?
I think so.
Apparently, a lot of her scenes were cut from the season because she and the showrunner didn't get along.
Really? I heard there was a lot of, like I saw a lot of tweets about her not getting enough time and, like, her barely being in this season, but I didn't realize there was, like, a backstory to that.
Apparently, that's why. Um,
Drama.
can't confirm because this is not a celebrity news gossip podcast as much as I try to make it one. And also, apparently, there were like a lot of situations in which the actors told the writer, like, hey, you wrote me naked in this scene and I don't want to be naked or this seems unnecessary. So I found that interesting as well.
That is very interesting.
Uh huh. Um, so yeah, there's some
Hmm.
drama. Apparently, too, they started filming season 2, then they had to stop because of the pandemic, and
Yeah.
allegedly it was like all rewritten the whole
Oh,
season from what it originally was supposed to be.
interesting.
So, yeah, that's just some Euphoria tea.
Some yeah, BTST. Love it. My weekend was very low key. I barely did anything,
I
but I
love
felt like
weekends like
that
that.
was needed because I had had, like, a cold last week, and I
Yeah.
feel like I just needed a weekend to just, like, relax and do nothing, so did a lot of that. I got a manicure and a pedicure, which made me feel like a whole new person,
Yep.
as it always does, and I spent a lot of time reading, which is exciting. I'm reading a book that I actually have already read before, but I wanted to reread it because the sequel just came out and I forgot everything that happened, so I needed to read the original. It's called Crescent City. If anyone has read this series, let me know because Olivia and I are obsessed with Sarah J. Maas, who wrote this series, and ACOTAR. Have we ever discussed ACOTAR on this?
No, and here's why. Because
It really deserves its own episode.
here's the thing. I get a lot of shame from the people that I know, my friends, for reading this series, which the acronym is
Really?
ACOTAR. It's called A Court of Thorns and Roses. Yes, people give me a lot of shit for it because it gives off interesting vibes from the cover. They've been recovered, so I would like to say that.
Yeah. I do feel like the
Also,
artwork is a little bit deceiving.
it is deceiving. Also, there is a lot of intimacy, shall I say, in these books, and there's also a lot of fantasy, and my friends make fun of me and say it's my fairy porn. Now, I think that's rude and also degrading to the work, but that's why I don't discuss it that much because
Okay. Okay.
haters gonna hate.
Haters gonna
Um,
hate.
but it's
Well, if any of
amazing.
you listeners do read this series or her other series, let us know because not enough people read it, and I would really love to discuss it with somebody.
Yeah, and her books are like in my top 5
Yeah,
of
the
like
ACOTAR
favorite
series is like
series.
my up there series, like with Harry Potter. Like they're not in any way similar, but in terms of like favorite
Yeah.
series, it's like Harry Potter and ACOTAR.
It honestly
And
might be my favorite series of all time.
yeah, it's so good. I love rereading it. And they're apparently going to make it into a TV show. I don't think it's been cast yet, but there's like a script, and I think the showrunner from Outlander, I believe, is working on it.
Yes, which I'm very excited about.
Yeah,
Um, but also, if you would ever like to hear an episode of Rebecca and I talking just about our favorite books, we could do that too.
let us
I don't know
know.
how interesting that would
Especially
be, but we could do it.
we read a lot of fantasy books, so
A lot of fantasy books, a lot of romance, like not romance in like
like a
the cheesy
romance
romance
novel,
books,
but
but
like
like
yeah,
books about love. Yeah,
right.
love those.
Yeah, fantasy, a lot of books about princesses, people with special
Oh, hell,
powers.
I love a good book about a princess, let me tell you. All right, well, enough chit chat for now, but we'll be back with more. We're so excited to get into it with our guest, Laura Flanagan.
Hello, everyone. We are so excited to have with us today Laura Flanagan. She has a lot of letters after her name. They are MSN WHNPBC, which stands for a Master of Science in Nursing, Women's Health Nurse Practitioner, board certified. And we are so excited to have her here today to talk about women's health and questions that we have for her about that. To give you some background on Laura, she graduated magna cum laude from Brown University with a major in psychology. She then worked in the finance industry for a few years in New York City. And after that, she decided to embrace her passion for women's health and went to Vanderbilt University to get her master's of science in nursing. And now she works as an NP at a practice in New York. And Laura
Woohoo.
and I go way back because she and I went through all of elementary, middle, and high school together. And I would say we became like really close friends in high school, but we've known each other since we were very small. So we are dear friends, and I'm so excited to pick her brain today about her profession.
Yay. Thanks for having me. Thanks for such a great
Yeah,
introduction. Yeah.
absolutely. It's not hard when you have those credentials to talk about.
Yeah,
But we're
what
so excited to
letters?
have you. Yes, yes, so many letters.
Yeah. We call that alphabet soup, all the letters after the name.
Love it.
I never knew what those meant. I knew what the MSN meant, but I never knew what the WHNP dash BC
Mhm.
meant before. So already learning something new.
There's different specialties. You could be like SNP, family nurse practitioner, psych mental health NP. So it ends up being lots of different letters and combinations of things. But yeah, but I am WH for women's health.
So we figured that it was the perfect time, especially given that it's Women's History Month, International Women's Day, to talk women's health specifically.
Yeah.
And so to get started, can you talk about what does women's health encompass?
Sure. So basically, all aspects of healthcare that affect women, which that can mean people who identify as female or people who were assigned female at birth but perhaps don't identify as women, just everything for their healthcare, being from primary care and obstetrics and gynecology. So specific for me, I typically see patients from old enough to have had their first period through to menopause. Um, could be up to age 80s, 90s, but for the most part into like the 70s. So usually it's like 12 to 70 is the age range of patients I see, and doing mostly their GYN or obstetric specific care, but I do some primary care stuff too.
That's
Cool.
awesome. I also think
Hmm.
too what's so important about women's health is I think, I was even just saying, this is so relevant for people who deal with women's health issues, but it's also really important for people who maybe don't deal with these issues and don't have any understanding of what it's like to, you know, have to deal with a period or have to deal of course everyone has hormones, but let me tell you, estrogen, she's a bitch. So I think everyone can benefit from learning about this.
That's
Um,
actually a common comment that I get as women are like sliding down the table for their pap smears, like, oh, men will never know. Men will never know what we have to deal with. And I just validate that.
and you know what? They might never know, but we can talk about it a lot so that they really get a good understanding.
Yeah. Or sometimes I'm very supportive of women who bring their male partners with them for like IUD insertions and like see what I'm doing, to establish contraception for a relationship. Like this is what it's taking, and
Yeah.
Totally.
bringing
Yeah.
them into the conversation.
Yeah. Or even just like being on, hormone regulation
Hmm.
medication, which you can be on for a lot of things, but, women who are on the pill, which I feel like is super common for period management or acne or birth control, whatever it is, like there's a lot of hormone manipulation going on that people just can't see. And it might be for the better, but it's like there's a lot going on. So that you don't really understand until you're experiencing it. But anyhow, I'm digressing a lot. We would also love to know too, how you got into women's health. Rebecca and I know you personally, obviously, so we know that this wasn't your original track when you were thinking about your career. So we'd just love to hear how you got interested.
So, like Rebecca mentioned earlier, I worked in finance before for a big corporate financial company in the city. And I enjoyed it. I definitely learned a lot, but I wanted to do something that felt more like I was directly impacting people's lives and working more with people. So I thought about a lot of different paths, got a lot of different advice, and talked to different people. I thought about medicine, social work, psychology, and ultimately, after a lot of thinking, decided to pursue nurse practitioner because I wanted to go into women's health, mostly influenced by I took some like gender related courses in college. I also worked as a sexual assault counselor, or volunteered as a sexual assault counselor while I was still in the city working in finance, and just felt like I had a lot of opportunity to impact lives working in women's health. It's just a high degree of sensitivity and understanding needed.
Yeah, I think it's super interesting to hear, why you went into this role. We talked about it a little bit in our last episode that I was also interested in going into nursing for a hot min.
Yeah.
And for a lot of the similar reasons of just being able to make an impact and working in an area that can be super sensitive because I don't know what it is necessarily about women's health that it just feels like, yeah, a sensitive subject sometimes, very it's
Mhm.
so personal, and I think I know why it's so personal. It's very much up in your business when it
Yeah.
comes to women's health, and so it takes, a lot of trust, I think, between you and your provider, and I think it's one of those areas too of practice that takes a little bit more, like, bedside manner, I guess, if that makes
Yes.
sense. Like, you really have to
Mhm.
be able to talk with your provider, where sometimes it's like I actually happen to love my sinus doctor, but with my sinus doctor, it's like, do we really have to have, like, a personal conversation about my lifestyle habits and my sexual partners? No.
Mhm.
But do I have to talk to my gynecologist about that? Yes, and that's just,
Yeah.
like, an
The
interesting conversation.
the topics are very intimate, and it's people are disclosing to me things they really don't talk to anyone else about.
Yeah.
So I think that just makes it feel a little bit more intense. And I've heard it all. I tell my patients that, like, nothing you say is really going to surprise me or shock me. So people should never feel like they have to hold back.
Yeah, and that's
Yeah.
wonderful. I'm
Hmm.
wondering too, we talked about how you're a nurse practitioner, and a lot of times when you go to a women's health clinic or doctor's office, whatever, you can get a lot of different types of providers when you go. So sometimes you get a nurse practitioner, an MD, physician's assistant, etc. So we're just curious if you could give, your 2 cents on maybe the differences or what kind of care can be provided by those types of people.
Yeah, that's a great question. So at the practice that I work at, we have a really nice mix of different types of providers. So NPs, PAs, MDs, DOs, so physicians, and what we would call like advanced care providers, which are PAs and NPs. And probably for the most part, patients don't notice too much of a difference. We each have our own panel of patients. I'm walking into the room, taking care of that patient, doing their exam, prescribing their medications, and I am empowered to independently handle each patient case. Now, with that, I have to acknowledge my scope in which a patient who is incredibly complex, especially like a pregnant patient with a lot of complications, the 38-year-old woman who's pregnant with diabetes and hypertension is not going to be the best patient for me to see. So sometimes things get elevated to one of the physicians, but for the most part, I come across as, the provider who's taking care of you that day is going to handle from A to Z everything you need. And we're all collaborating behind the scenes to get that done.
That's wonderful. I like that you have a range of different people that work in your
Yeah.
office. And you were kind of speaking about the panel of patients that you see, and I'm curious what your day to day is like working as an MP.
Yeah, so I see both pregnant, postpartum, and like regular GYN patients. So that could be like annual visits, pap smears, breast exams, infections, vaginal infections, breast lumps, birth control consults, STD testing, um, basically all GYN related care. And I usually see about 20 patients a day. So it's
Wow,
pretty
that's a
fast
lot.
paced.
Yeah, that's a
Yeah,
lot.
but when you develop your own tips and tricks to kind of like make your charting faster, to have more routine, we have medical assistants who are excellent, who assist with a lot of like the history taking vitals, to help keep things moving so we can see as many patients as we can, because a lot of people, if they're having a problem, they want to be seen right away, so we always want to make sure we can get as many people in as we can to get them the care they need.
Yeah.
Yeah, that's so many more than I was anticipating. I don't
Me
know why I thought it
too.
was
I don't
maybe
know
like
what
8.
Yeah, me too.
No.
It's
A
like
lot.
it makes sense, like,
It's a challenge though, especially for patients, who need the extra time or are dealing with something really sensitive. Sometimes I wish I had more time with each one, and you kind of have to
Yeah.
figure out how, if it needs to be a follow-up visit, or if you give them a little bit more time and someone else you're seeing needs a little bit less time, or charting at the end of the day, charting from home, to be able to get everybody the adequate care they need.
yeah.
That gives me a little more empathy for my
Thank you.
physicians and people when I'm like, "No, please, like, squeeze me in," and they're like, "We
Yeah,
really have no time."
I know, I feel like whenever I
yeah.
go to make an appointment with any of my like healthcare providers, whether it's like primary care or like my like gyno or whatever, and I'm like begging them to see me like that week or the next week, and they're like, we are so booked, but then they always squeeze me in, and I'm like,
Yeah.
angels.
I feel
Yeah.
like maybe too, and you can correct me if I'm wrong, Laura, sometimes, like, if you have a really good relationship with a certain provider, like, for example, my sinus doctor, love her, see her all the time. I was having, like, an earring infection, and they didn't have space for, like, 4 to 5 weeks, and I was like, "Listen, my ear is currently infected, like, I can't wait 5 weeks." And then they were like, "Fine, come in tomorrow at 8 a.m." And I feel like it's just because she knows me, and she's like, "Yeah, it's fine, like, I'll come in early for her." But I appreciate that, I know
Mhm.
she has kids, and she's already busy, and she just yeah, but I definitely have a lot of sympathy for now for when they're like, "Listen, we don't have room for you."
Mhm. Yeah.
So I feel like we wanted to get into some like more health specific questions. But before
Yes.
we do so, I want to give a quick disclaimer to all of our listeners that while Laura is a health professional, she is not diagnosing listeners via podcast.
No.
So if anyone have their own questions or their own medical issues, they should also seek out their own healthcare provider for their specific issues. But we're going to ask Laura some general questions anyway.
Yes.
And another disclaimer is, we've used a lot of pronouns and saying things like women as we're discussing this, but as Laura mentioned earlier, not everyone in need of this kind of care uses she, her pronouns or identifies as female. So to the extent we're using that pronoun, we want to include everyone, and it's not limited to people who were born as women.
Yeah, it's a great reminder that there are all types of people who go to a women's health clinic. And so, once again, everyone should know this info.
Yeah.
But yeah, hopefully this podcast only encourages you to seek out, someone to provide care for you if you do not have that already.
Yeah, absolutely. So one of the things we wanted to know was what should people or women be doing for their health on an annual basis?
Sure. So the components of kind of a typical annual checkup, so we would call that a well woman exam in the GYN space, would be first, I would collect like their history, talk about the medicines they're taking, do some assessment for risk factors. So basically just having a medical professional like look at your whole picture of your health. Um, and then moving into more of like the physical exam. I offer a breast exam to my patients every year. There's some debate about how necessary a breast exam is, but I find most of my patients don't find it particularly invasive and are okay with having a breast exam every year, but that's something you can always decline. And then probably most notably would be the pap smear, which is a screening for cervical cancer. There are different guidelines about how often you need to do it. Some patients prefer to have it done every year. That was kind of the traditional pap screening. A lot of research now supports that can be postponed to every like 3 to 5 years, depending on your history, if your pap smears have been normal. And pap smear is done by inserting a speculum into the vagina to visualize the cervix. We use a gentle brush to take a superficial sample of cells from the cervix, which is then sent to the lab to see if the cells look normal. Also screens for HPV, which is a virus that can cause changes to the cells of the cervix. And then the last part of the exam is usually what's called a bimanual exam, where we feel from inside the vagina and over the belly to see if we can feel any masses or elicit any pain. So that's kind of like the typical well woman exam in a nutshell. For women over 40, it's also recommended that they start getting mammograms. Over 45, I always ask if they've had a colonoscopy. And if they're postmenopausal, like after 65, I'll talk about like bone density scans too. So it's kind of more of like the primary care stuff that I'll screen for as well. Because a lot of women will use me as their primary care doctor, which they should not be doing, because that is not my expertise. But a lot of times women are more comfortable coming to their gynecologist to get their routine care, and they might not be getting like an annual physical with their primary care doctor. But that is a really good compliment that you should be doing both every year.
That's really interesting to know. I think my gynecologist's office also like does some things that maybe are not necessarily out of scope, but just like reminders, because a lot of people don't have primary care doctors, like flu shot reminders.
Yeah.
Like they
Exactly.
offer.
Yeah.
I actually think this year I did get my flu shot at the gynecologist because they were offering them, which is something, I mean, you could do that with your primary care doctor, or like, go to CVS and get one. But I feel like they take that role on as well, probably because like you said, so many people use that as their yearly checkup. It was also really interesting to hear what you were saying about the breast exam, because I didn't know that some people think that you don't need to be doing that. I love that my gynecologist does that because I forget constantly, and she tells me all the time, like, you need to be doing this on like I don't know if it's quarterly or monthly basis, basically checking for lumps.
Yeah, that has kind of changed the guidance there. I usually the preferred term is breast self-awareness rather than like a monthly self-breast exam. Because sometimes people feel like they need to be doing this very precise exam and they need to learn how to
Yeah.
do it. And, that's not really the goal. It's just sort of being comfortable, touching your breast and knowing what they normally feel like. So that if something changed, you would notice the difference. And it doesn't need to be this like very formalized monthly exam, which is kind of what we used to say.
That's
Um,
good to hear because yes, that was my constant fear. I'm like, how am I gonna know? What am I looking
Right,
for?
right, right. What am I looking for?
And I know one thing that my provider told me, and I'd be interested to hear your take on it, Laura, is that like in your breasts there are, I don't know what they're called exactly, like like what are they called? Like nodes? That's not the right word.
Glands?
Glands?
Yeah, there's different types of tissue in the breast. Like another
Okay.
thing, sometimes when I ask my patients if they've been checking their breasts at home, they'll be like, "Oh, I think everything is a lump. I don't know what I'm feeling for. It all feels weird, so I don't check myself." And there's validity to that. Your breasts are made up of connective tissue, tendons, fat, glandular tissue that will eventually possibly make breast milk, the ducts that release the breast milk. So it isn't all just one homogeneous texture. So it is normal to feel it and like feel like it doesn't feel like just normal skin, right? It feels like there's something in there.
Totally. But my provider told me that they kind of match on I
Yeah,
so I don't know how that, basically when you're feeling around, you should feel like, "Oh, okay, this kind of feels similar from like one breast to another." Obviously,
yeah,
there's like differences. You can tell even if you just like look in a mirror that your breasts often look different. They're different sizes,
hmm,
but she was saying to me that you would notice if there's like a very obvious difference from like the same portion on either breast. And that has given me a little bit of comfort of like, okay, they feel pretty much the same in this area. So like I think I'm good. But I'm curious if
yeah.
you agree with that.
No, yeah, I agree. That's something that I'll sometimes put in my notes for the physical exam. If someone feels to have like quite dense breasts, we would say fibrocystic breasts. I'll say like breasts symmetrically fibrocystic throughout, meaning maybe they feel more dense, but it isn't just on one side. Both sides feel similar, which is more reassuring than if you felt one discrete lump on in one breast.
Yeah, that's good to know. I feel like that's always, I don't know, something that I forget about. I'm trying to be better about it, but I also go to my gynecologist every year. I love seeing her. She's very friendly. She's just like
Hmm.
she's so chipper when I when I walk in, which I really appreciate because I don't know, especially I started going to a gynecologist when I was 16 and it was very scary. I feel like when I first
Mhm.
went because all of a sudden it's like spread your legs wide open
Right,
and
right.
we're going to just like
Well, it's like undress completely, put on this gown, get on this table, put your knees up, and it's like,
yeah, and then
what?
we're gonna just be
Yeah.
touching all of the areas that, like, no one else has
Has ever
touched
touched. Yeah.
since you were, like, 3 years old and, like, couldn't wipe, you know?
Yeah.
And that's like, "Hello."
Very accurate. That my first GYN experience, I was not sexually active, so I was very grateful that the gynecologist I saw was like, "Let's just meet in my office." And I fully clothed, sat in his office, and we just talked rather than needing the discomfort of being undressed.
That's
So,
nice. That did
Yeah, I
not
feel like that's a
happen for
nice
me.
I know. I feel like that's a nice little intro, like, let's warm up to each other and have a conversation first.
yeah.
One of my favorite memes on the internet is, like, me hiding my underwear from my bra from my gynecologist. I don't know if you see this, it's like me, like, hiding my underwear, like, under my sweater, even though my
Yeah.
gynecologist is about to, like, go in my vagina.
Yeah.
It's
That's
like
funny. I've never seen that before. That's funny.
and I do it every time.
No, I
I,
do the
like, hide
same
my
thing. I,
bra.
like, fold it up, like, in my little pile of
Feel like I'm not
clothes,
wearing
like
it.
Yeah.
Like, I don't wear underwear or a
How
bra.
dare I see your underwear? Yeah.
Yeah.
Well, on
Um
that train of thought, like, as we were saying, this kind of healthcare can be very personal, very intimate, and very sensitive. So, can you
Hmm.
talk a little bit about the role of, like, consent and communication in an appointment, and, like, what should people ask for if they're feeling uncomfortable or nervous?
Yeah, I see a lot of patients who are not thrilled to be there, right? They don't really want to be having this exam today and they're nervous. And, one of my professors, the director of my program at Vanderbilt, I remember her looking us all in the eyes very seriously and saying, "This is an elective exam. your patient should never feel like because they're showing up to see you, they need to do certain things, or that you're going to be upset with them if they don't want to do certain elements of the exam. So I always try to be very understanding, offer things as options. Like a more subtle thing that I do with all my patients too, before we move from sort of the history taking discussion to the physical exam, is I always say, so for today, for your annual checkup, I recommend a breast exam, a pap smear. Is that okay with you? Before I just say, okay, lay back, we're going to do the breast exam. And I
Yeah,
think
put
that's just
foot
like a
in
very,
stirrups.
yeah, I think it's just a more mindful way to be like, this is what I recommend. Is it okay? And it gives patients a moment to be like, yeah, like I'm really nervous about it. Or like it gives them a moment to either say yes or no, or why do I need it? Or what is that? I don't really know what a pap smear is. Um, so that, patients feel like they have more control over what's happening. And everything is optional. I try to be very, quick and gentle and to let people know what's happening so nothing comes as a surprise when they're being touched. I always ask for consent before I touch. Um, so people should always feel like they're in control and they can ask questions and they could raise concerns. So I can tailor my exam to their needs.
Yeah, I think that's so important. The last like women's health appointment that I had, I saw an NP and she was sort of like the first professional I'd seen in that space who asked me a lot of questions and like asked for my permission before doing a lot of things and also explained everything she was doing. She was like, "Can you do this?" She's like, "I'm going to do this. Is this okay? Like how is this? Like and now I'm going to do this. Is that okay with you?" And I really appreciated being asked and feeling like like you were saying had a little bit of control over the situation to be like, yes, that's fine. And like now I know what to expect. And like I asked her like what she was doing while she was doing it and she was like more than happy to tell me. And I feel like that's a little bit more calming when you feel like you're kind of informed about what's going on versus like, I don't know, when I felt like I was younger and I had appointments, like no one was really like sort of explaining to me what was happening. And I feel like I would have really appreciated that.
Totally.
And I always appreciate it when patients take the time to say, I've had a bad experience with this before, or I'm really nervous, I've had pain with this before, because that just gives me a little bit more of a cue of how to take care of them. Because I also have some patients who, are 45, have had 3 vaginal deliveries, and they have no concerns at all. Just get it done. I'm sliding down the table. Here's my vagina. So that is a different kind of tone than like the 21-year-old who's never had a pap smear and is really nervous. So it's, I'm going to read off of your cues, advocate for yourself, and like let me know. Of course, it's my responsibility to ask you also, but be honest with me and tell me what your concerns are so that I can take care of you the best way.
Yeah, and that's also really good to know for anyone listening if does not sound at all like what your experience has been at a women's health
Find somebody
center.
else
Yeah, yeah,
because
yeah.
I'll
If
let
you
you.
are feeling incredibly uncomfortable, if no one has ever asked for consent before, just going up on in there or doesn't explain what's going on, maybe find a different provider at that clinic or just a completely different place to go,
Mm-hmm.
because it can be a very different experience if you don't have someone who's very, understanding that this can be, you know, an awkward experience. Or if you just don't care at all, great. If you're like,
Like,
whatever,
Mm-hmm.
here you go. I feel like now
Mm-hmm.
when I go to see my NP, it's very like I know her very well and I feel very comfortable, so I'm not too worried about it anymore. But it used to be very jarring for me. I also used to personally have a lot of sensitivity when they would just like touch my stomach. I don't know why. Like, I don't know where that came from, but it was just like the second they would touch my stomach, I was like, whoa. I was like, ooh, I'm not feeling comfortable. Like, what's going on? And so it definitely helps now that I'm like, I know who my gyno is. Like, we
Mm-hmm.
chat. I don't care. Like, it feels way more comfortable for me now because in the beginning I felt really like, I don't know, just nervous about that. Um, so yeah, if you're not experiencing this, definitely, take a second and think about that. Because we also want to talk too. Sometimes we already said it's very sensitive when you go to the gynecologist or for any sort of women's health questions, but there are some like common biases or like maybe like areas of even more heightened sensitivity when you go. So we wanted to talk a little bit about that and maybe things that you've heard or people are like extra nervous to talk to you about when they come to see you?
So probably a common one that people might be a little nervous to ask about is STD testing, which to me is just a very routine part of my job. I offer it to everyone. So patients usually don't even need to feel like they need to ask for it because I'm going to ask them if they want it. But that is just such a common part of my job. And quite frankly, at urgent cares, at primary care, that is a big part of what we all do. So you should never feel ashamed to ask for it. Or if you're positive for something, you shouldn't feel ashamed to ask all your questions about the treatment or the implications, because that's literally my job, is treating infections. Um, so people shouldn't feel ashamed to bring that up as part of their discussion.
Yeah, that's a great point because I think, especially, I remember in college, like those years, how taboo it was to talk about STDs or STIs. And I remember, like, you'll hear rumors about, like, oh, I heard so and so has chlamydia. And, like, they're kind of scrutinized or, like, given this, like, I don't know, idea that it's like gross or they're gross or whatever. And I think it's unfortunate because no one says that when you get a sinus infection, you know, like no one
Right.
says that when you have like the flu. I mean, it's something that is very normal. And of course, it's great to avoid that with proper protection or, you know, conversations with your sexual partners, but it happens and it's better to just feel comfortable talking to your provider versus like hiding it or feeling ashamed about it.
Especially because it's not a foreign concept to me. It's people should not be afraid to say these words: chlamydia, gonorrhea, I want to be tested, because it's, to me, like anything else, it's not a scary word.
Yeah, and I know
Yeah.
one thing Rebecca and I were talking about prior to recording today was like what happens when people get herpes, because I feel like herpes is
Mm,
one that is really comes with a lot of stigma,
yes,
and because it's this idea that you have it forever, right? That you and it's like you're like it's like in the Scarlet Letter when you have like an A on you, it's like you're branded like as someone who has herpes, and I would just love to hear your 2 cents on that because I feel like it's hyped almost like a little bit more than it should be.
Needs to be. Yeah.
yeah, herpes is really a tough one. I think The Hangover contributed to that, with everything that happens in Vegas stays in Vegas, except for herpes. That shit'll come back with you. Like, I
Yeah,
feel like that like
yeah.
ruins our generation. That
Yeah.
quote in that movie. Um,
Yeah.
because herpes is very common and there's a lot of misconceptions about it and about the screening for it. Um, there's two types of herpes simplex virus, 1 and 2. One was traditionally thought to be primarily causing oral herpes or cold sores, and 2 was thought to be genital herpes. But at this point, it is really irrelevant. You can have one on the genitals, you could have type 2 causing oral cold sores. Um, and there is screening in the blood to see if you have ever been exposed to it, but it is really not recommended to screen that way because high percentages of people have been exposed to herpes and will come up positive in their blood, and people freak out and are very, very nervous and worried, and who gave this to me, and someone's cheating on me. And it's really not the way to think about it. Just because you're positive in your blood does not mean you will ever have symptoms or spread it to anyone else or it will cause any problems in your life. So I do not routinely collect herpes testing in my STD blood work. But if someone presents with painful ulcers on the vulva, they can be directly swabbed to see if they're caused by the herpes virus. A lot of people will have one outbreak and will never have one again. And there's a small subset of people who have like recurrent outbreaks and might benefit from taking like a daily preventative medication to prevent outbreaks from happening. But this is not a death sentence if you have herpes. I try to do a lot of counseling about it because it is something that makes people really nervous and scared if they have cold sores or if they have an initial outbreak or if they know their partner has. And it is a tough one to explain because it isn't just like chlamydia, like you have it, we're going to treat it and you're going to be done and try not to get exposed again.
Mhm.
Right.
So it's a good question, and it is a little bit of a tough one to counsel on because if you're positive in your blood, you were somehow exposed, and we don't know if it's oral or genital if you've never had symptoms, basically.
Right.
Sounds
Yeah,
like one
that's
of
so
those
complicated.
things where if you do have herpes, like you said, it's not a death sentence, and you should be meeting with your provider to figure out kind of the plan that you need for you. But yeah, it sounds like it looks different for everyone. And I think when you hear someone has herpes, you put this like assumption with them of like now their sexual lives or sexual experiences have to be very different. And maybe they do for some people and maybe they don't for others. So it's just a very personal conversation. But yeah, I'm really glad that we talked about that because I think there's just a lot of misinformation about herpes out there and what that means for you and your sexual life. And it's
Mhm.
unfortunate. But I'm glad that we can touch on that today. Um, Another thing that we wanted to talk about with you was just like when you go to see your healthcare provider, your woman's like healthcare provider, is there anything you should be embarrassed about? Like, are there things that you should,
Do you need to prepare?
yeah, do you need to prep? Do you need to look cute to, to see your gyno? Are there faux
What's
pas?
the etiquette?
The etiquette, good one. Well, probably one of the most common things I hear is patients say, "Oh my God, I'm so sorry. I missed my waxing appointment yesterday. So I have pubic hair." Like it's some kind of secret that they grow hair on their vulva. Does not matter. Literally, do not care what your pubic hair looks like, or if you shaved your legs, or if your toenails are painted. None of it is relevant really to my exam. And in fact, removing hair anywhere on your body is not necessary and can just cause like irritation, ingrown hairs, infection. So I frequently will tell patients the healthiest thing you can do is just leave it alone. Or if you want to do anything like trimming is better than shaving or waxing or sugaring, anything that removes hair directly down to the skin. So when people haven't done any grooming, I'm happy to see it. That's healthy and natural.
Yeah, that's great. So everyone listening, you don't need to you don't need
You
to
don't
get
need a full pamper day before you go to the gyno.
you don't need to get the hair did before you see your gyno.
It's good to be clean, right? It's nice
Yeah.
Yeah,
to
yeah.
have showered, within the last 24 hours. But no particular grooming is necessary. It horrifies me to think that someone would have a waxing appointment like just because they're coming to the gynecologist. Like, what
Yeah.
a waste of pain and money to do
Yeah, and
that.
money. Oh my gosh. That actually brings up
Yeah.
another question for me though, because I've heard a lot of different things when it comes to like maintenance of your like
hmm
vagina vulva area. I know when I was a kid, I used to like wash down there with soap and then I would be
hmm
super itchy. And I finally asked my doctor about it and she was like, stop doing that. She was like, use warm water and that's all you need. But is that true? Is there a difference for different people?
Yeah. So for some people, especially if they're really sensitive or like have eczema prone skin,
At
water
me.
only is fine. Yeah. For most people, the soap that I always recommend is the Dove Sensitive Skin Soap because it doesn't
Mhm.
have any fragrance. It has very gentle surfactants that are unless likely to irritate you. And I tell people to wash like with a flat hand. So keeping your hand, like a paddle and then just cleaning everywhere, but not pushing any soap up inside and just cleaning, the external structures. And then rinsing and making sure you get really dry after is important because certain vaginal infections love like the moisture, whether it be you didn't dry off after you showered or your sweat, oil, or you're not wearing breathable underwear. That's like the enemy for skin irritation or yeast infections in particular.
That's good to know. I never knew about like really drying off after you
hmm
shower. So that's
Yeah.
good to know.
That is good to know. And I feel like you see like all these products at the store that are supposed to be for
hmm
like cleaning and
It's
scents and all these
marketing.
things. I
It's
Yeah.
all
know.
marketing. You
Every
do
time
not
I've
need,
gone, they're like, "No, don't do that. Leave
Yeah,
it
yeah.
alone."
I
yeah,
have
white,
crazy sensitive skin, so I just use warm water.
yeah, and any of those like baby wipes, not necessary. You don't need any fragrances, any dyes. You don't need special soap for down there. Just very basic, and if that means just warm water, that's fine too.
All right, you heard it here. Don't fall for those like I see them all the time, like the
Like
I know,
the
I
special
see
soap.
those,
summer's
like,
eve.
commercials, yeah.
Yeah,
It's ridiculous.
yeah.
Um, and then I would love to talk to you a little bit about like I mean, I feel like we could talk to you forever, so I don't wanna there's so many things to talk about, but a lot of times women who experience periods, like, they use birth control, a lot of times hormonal birth control, and there are a lot of things you hear about side effects that can come with that, and I'm curious, I mean, I guess, like, what your take is kind of a generic question, but I don't really know where else to start on, like, what can kind of come from going on hormonal birth control and the negative side effects.
Sure. I mean, if we focus this conversation mostly on like birth control pills,
Mhm.
probably is the easiest.
Mhm.
It's a little bit of like a double-edged sword, I would say, because a lot of people take birth control and they feel great. They have no problems at all. They don't feel any side effects and they love it. And then there's a flip side of not wanting to like invalidate people who do feel a difference, whether it be like weight gain, change in mood, nausea. Like there are known side effects, but a lot of times patients are very nervous to start on something, and I kind of explain it's not like you're definitely going to have all of these horrific side effects that you've heard about. Like we want to validate and tell you like what the data shows, but there's a great chance that you're going to love it. It's going to clear up your acne. You're going to have short light periods, or you're going to have contraception. Probably the most evidence-based side effects of birth control are transient, coming in the first like 1 to 2 months of being on it. You can have some headaches or some nausea, some breakthrough bleeding, like some spotting as you adjust. And then it's more anecdotally that people report weight gain or change in mood. There isn't great research to support that that's really evidence based. But again, I don't want to invalidate people who like that was their experience. It's just that there isn't like a lot of research to support that. So it's like a little bit of like a counseling conversation, talking if patients have particular concerns, because they're coming in like at a higher weight than they want and they're nervous that this would make it worse, or if they have underlying mood issues, they're nervous that birth control will make it worse. I say like this is going to be individualized, whether it works for you or not. There's a lot of different formulas that we can try of birth control pills. And if you don't like it, you can always stop. That's the beauty of the birth control pill compared to some other methods,
Mhm.
is it's easy to start and it's easy to stop. So people don't have to feel like they're being like roped into something forever if they don't like it.
Yeah.
Yeah. I feel like something I suffer with a lot is this fear of talking to my provider when something's clearly not working for me. And it's like
Mm-hmm.
I
Mhm.
feel this like guilt of being going back and being like, actually, like I still don't feel good on this, or like I don't think this is working for me. And I feel like if you have a provider like Laura, like all the things you talked about previously, you should be able to say, hey, this isn't working for me and try something else. Because I think sometimes people feel stuck. It's like, oh, now I'm on this birth control pill and maybe it's not working for you. And you're like, oh, but this, like, I'm stuck with this. Like, I have to keep using it. And it's like, actually, there's so many out there. You can really kind of it sounds like, if you're having the right conversations with your provider, they should be able to suggest, let's try this instead, or, maybe we try a different form of contraception for you if you're worried that the pill is making you gain weight, etc.
And that's part of why I really love women's health too, is there's so much opportunity to provide individualized care. Like between all the different methods of birth control, they're all great choices. It just depends on you and who you are and what your priorities are and your needs are. Versus, I think in a lot of other areas of medicine, it's like you have this, so you get this. You have that,
Hmm.
so we're going to give you this. This is the treatment plan. Versus in women's health and in contraceptive management, there's so many options to pick something that's going to work for your lifestyle.
And so then on that same note, does birth control affect your sex drive? Because I've heard that before from my providers, and I wasn't sure how accurate that is or how it does that.
hmm So that's another one of those things that can be reported, but the research is a little bit inconclusive, comparing like people taking birth control to taking a placebo, whether we really see a difference. But there is some theoretical effect on your libido in that taking birth control, especially that contains estrogen, can increase a protein called SHBG, which reduces your testosterone. And your testosterone is like the primary hormonal component of your libido. So if you have
Mhm.
lowered testosterone, it improves your acne, but it can reduce your libido. So that's like a theoretical component of how birth control can affect libido. But again, in trials, it's been inconsistently seen as like an actual correlation.
God, being a woman sucks so much sometimes. It's like I'm trying to get rid of my acne, but I still want to have sex. And I also want to be protected from having a baby right now.
Well, that's part of it, though. That's part of it is that if you feel like free and less anxiety about having an unplanned pregnancy, then maybe your libido will increase. So this
Right.
is like very individual, and a lot of factors
Right.
play into libido than just like the medication that you're taking.
Yeah, that's so true.
Yeah.
It's just there's so many factors, and you kind of need to focus on one at a time. I know for me personally, I was on the pill for many, many years. And because my primary concerns were regulating my period and being protected from having a baby, because that was biggest actually that was probably my biggest fear in the world, was having a baby when I didn't want to. And my priorities have just shifted, and things that I want to focus on, not the baby part, for those listening, at my parents, don't worry. Um, but just there were other symptoms that I was feeling not great about. And so I just decided to stop taking the pill for right now. And because period management was not my top priority. And um, I think that's just great about women's health, and talking with your provider about what is your number one concern right now, and then you can kind of get your own customized plan based on what you need to focus on.
Yeah.
So when people come to see you, what issues do you see the most frequently? What are they most concerned
Mhm.
about?
Yeah, so my day is usually split about half and half between OB or pregnant patients and then GYN patients. So among the GYN patients I see, a lot of them are annual checkups, like coming in for their breast exam, pap smear. And then some of the like acute appointments or more of like a complaint-based appointment would be infections. People are having abnormal discharge, irritation. They feel some kind of lump or bump on the vulva or in the breast. I felt a lump on my self breast exam. STD testing, they just want to get a check. They have a new partner. They're thinking about becoming sexually active with a new partner. They want to get STD testing. Pelvic pain is a big one. We at my office are really lucky to have in-house ultrasound. So anyone like on demand who might need an ultrasound can have one as part of their appointment, which is really nice rather than having to get sent out to like a radiology center as a separate visit. And then a lot of birth control stuff. So either they're wanting to get established on birth control, or they're unhappy with their birth control, or appointments to actually insert birth control, like a Nexplanon or an
Mm.
IUD.
Mhm.
That's probably most. That's a good scope of the things that I see during a typical day.
Yeah, so there's quite a range there. Um, you mentioned people having like pelvic pain or pelvic floor pain. Um, why do some people like have that pain or have pain with sex?
Sure. So generalized pelvic pain can be caused by a lot of different things. So I ask a lot of questions about the character of the pain and when they notice it. Like I mentioned, we'll do an ultrasound to see if there's some kind of mass or cyst or something on the reproductive organs that could explain the pain. I always ask about GI problems too. If people are having issues with constipation, diarrhea, gas, bloating, that could explain the pain. Um, and then just to give a couple examples of pain that could cross over into pain with intercourse, would be like endometriosis. Endometriosis is a condition that can cause really painful periods and then can progress to generalized pelvic pain and pain with sex. Another separate of generalized pelvic pain, people who have pain just with penetration, it could be something like vaginismus, which is like an involuntary contraction of the muscles of the pelvic floor, such that penetration by like anything is almost impossible or incredibly painful. So that's kind of its
Mhm.
own workup. Infection is another common cause of pelvic pain, especially if you have an infection that ascends from the vagina into the uterus. That can cause a lot of tenderness, generalized pelvic pain or pain with intercourse. Or that people can have like anatomical issues that can cause pain with intercourse if there's like an imperforate hymen or a vaginal septum. Those are less common, but something that's worth being evaluated for. In older women, vaginal dryness is a common cause of pain with intercourse too, which there's lots of treatment options for that. So if pain with sex is something that's bothering you, there's a lot of workup that can be done and a lot of different treatment options depending on what we think the cause of the pain is.
Yeah, I feel like a lot of times, especially young women, if they experience pain during sex, they're just kind of like, maybe
You just
this
like
is
think it's
just like
part of the
what
Just
experience.
go
what
through, yeah.
happens. Like maybe this is just how it's gonna be, and
Mm-hmm.
don't take like actionable steps to look into why that could be happening. Because I think that's just once again not something you're really taught. It's definitely not in the conversation you have with your parents about the birds and the bees. It's definitely
Yeah,
not something that if you get sex ed in high school is talked about.
Definitely
yeah,
not.
And I feel like then if you're having conversations with your friends about it, like they don't know what the heck is going on. So I feel like we need to normalize that if you are having pain during sex, you should talk to your healthcare provider about that, not just think this is how it's going to be forever.
yeah. Let's also normalize lubricant. Lubricant every time, every day of your life. Lubricant is great.
Yeah, I think we should normalize that too, because I feel like a lot of times it's, I don't know, seen as kind of like weird or like a, I don't know, like a next level thing to like introduce into your life. I don't know. I feel like it's not as common as it should be
Well,
to
I think we
use.
should break down those barriers
Yeah.
because it
Yeah.
can only make things better, really.
I would
So
also recommend not trying to do any sort of weird at home. I'm just gonna try with things in my kitchen. I don't know. Maybe I could be wrong, but I just feel like people are like, "Oh, you know what? You should just use it's like just use coconut oil." And maybe that's legit. I don't know, but I just get nervous about people going into their kitchens and like grabbing whatever is in their pantry. Like, we're just gonna test out olive oil today. I don't know. That just makes me nervous.
so the coconut oil is a real thing. You can
Okay.
use coconut oil with condoms. So I always ask
Oh,
if
okay.
you're using condoms or not. But coconut oil is the best lubricant in my opinion. It has one ingredient. You can get it organic, get a big tub, and it's really unlikely to irritate you or cause a problem unless you're allergic to coconuts. But that's like the
Yeah.
only ingredient in it
If you're allergic
compared
to
to,
coconuts and you use coconut oil, like I don't know what to say about you.
yeah.
Like I don't know what to say.
But otherwise, if you use condoms, there's plenty of lubricants on the market that you can kind of, test out and try and see what you like.
Why can't you use coconut oil with condoms?
So you can't use oil-based lubricant with condoms because it increases the risk that it could break.
Okay. That's good
Yeah.
to know.
So you want to use water or silicone-based if you're using condoms.
Okay, great. I didn't know that.
Yeah.
So I'm just like, geez, I'm like an adult woman. I should know the answers to these questions. I'm like,
I'm
how did I never
constantly
know
learning
that?
things from Laura. This is great.
That's why this podcast exists. So
Yeah.
people can learn.
We're informing the masses.
Seriously. And kind of,
Along that oh,
oh,
sorry.
I think we're gonna ask the same question.
I was
I
just
would
gonna say
bet.
along that train of thought, because we were talking about coconut oil and lubricant, are there products for feminine care or for sex that you would recommend that people use or recommend that people avoid?
So some of it is like trial and error. We talked about like the soap thing. Like I like the Dove Sensitive
Yeah.
Skin soap. And generally just like don't use stuff that like smell perfumes, fragrancy things. Just like really keeping it simple. Your vagina cleans itself. You don't need to clean it aggressively, no douching. And then as far as lubricants or like pads, tampons, menstrual cups, some of that is just like trial and error. If you know that you like certain things more than others, or if you have really sensitive skin and you don't like, the more name brand generic pads, you want one of these like 100% organic cotton brand. I think that's great, but I wouldn't say I say one particular like menstrual product is better than another. I think again, it's very individualized what people like, but always like no fragrance. Think about like gentle, basic stuff, and don't let the marketing make you feel like you need vagina specific products.
Makes me think of like Tampax Sport. They have
Yeah.
like the
Yeah,
sport
exactly. Yeah.
they smell crazy.
Even like eye cream, right? Like you don't need separate cream for your eyes, really. Like it's all just skin.
Yes, totally. Marketing will get you every time. And like, listen, no shame if you've fallen into these marketing ploys, but yeah, it's good. It's good to
Good
know.
to know.
I'm curious also, this is just like on a personal note, what your thoughts are on menstrual cups, because I recently have just been exploring those myself. And I felt all of a sudden like I was 13 again, like trying to learn how to use a tampon, putting in a menstrual cup, because it's so funny. When I first ever tried to use a tampon, I was like, this is horrific. Like I
Traumatic.
was gonna say Rebecca was actually there for that. So apologies to Rebecca for having to be so present in that experience. And then trying to use like a menstrual cup, I was like, what is happening? Like, why can't I figure this out? Like, this is so much more like intimate that I want to be with my vagina. Like, oh my gosh. So I'm just curious what your thoughts are on those.
Yeah, so menstrual cups I think are great as far as like the environmental impact, having something reusable. They're clean. I mean, you clean them and there's instructions on what you're supposed to do. But they last a long time. I think it's really just like the learning process of how to put them in correctly. Which, just to give like an example professionally, when I'm doing a pap smear, using a speculum to look for the cervix, it isn't always like right there, easy to find. Like a good amount of time, I'm kind of looking and need to make the cervix kind of pop into place. So when you're putting in a menstrual cup, you're wanting the cup to like go right over the cervix so that the blood is going to go into it. So that's not like the most easy, even for me as a provider, looking directly with a speculum trying to find your cervix. So for you to be doing that at home, just like feeling and putting this cup in with your fingers, like that's not the most easy thing to do. I think it takes some practice. And people I know who use them might have like some accidents in the beginning as they're like figuring out how they work, because like they may leak. But I think they're a great option, and a lot of people have a lot of success with them and like how long they last.
Yeah, that was me all of a sudden, once again, felt like I was 13 wearing a giant pad, like a diaper, because I didn't know how to put in my menstrual cup. So I was
Yeah.
just like, ooh, a lot of flashbacks. I just remember being like a young teen, afraid to use a tampon, using a giant pad, like bleeding through those, waking up being afraid I was going to like bleed through my sheets. Like,
Another no-no with menstrual cups is if you have an IUD. There have been people who have accidentally pulled out their IUD when they were pulling out their menstrual cup. Because it's like a
sounds-
my God.
suction,
Oh my
like the cup
gosh.
is supposed to be suctioned over the cervix so that the blood is just going into the cup and not leaking out. So that has happened where people have pulled out their IUD with their menstrual cup,
Oh my
which
God,
is
that
really
sounds
That
traumatic.
irritates
not
so
good.
much.
Be careful, ladies.
Yeah.
Yeah.
You've heard it here. Be careful.
Yeah, seriously. I feel like the one, okay, I shouldn't generalize because I don't know everyone who has an IUD in this world, but I feel like the one good thing with an IUD is it sounds like periods are a lot nicer when you have an IUD.
Yeah, if you have a hormonal IUD, periods can completely go away or be like very light. You might skip them, just have some occasional spotting. If you have a copper or a Paragard IUD, it can basically do the opposite. It can make your periods heavier and longer. So the hormonal
Cool.
IUDs are more popular.
Yeah.
That sounds horrific.
Yeah. Yeah. Imagine it being worse than it already is. Oh my God.
No thanks.
That's another one of the misconceptions, where people are so scared about hormonal birth control and they've heard all these horror stories about how it's going to make them gain weight and be the worst thing ever. And when I explain, like, okay, there's this non-hormonal IUD, but it's going to make your period worse, quite likely, versus very low dose hormonal IUD that will make your period like go away and you're unlikely to have any systemic side effects. It's like, why were you afraid of hormones to begin with? This is like a great situation.
Yeah,
Right.
I want to run away from the copper IUD.
Yeah.
Just mention that, but that's just a personal note. That should not be everyone's takeaway from that. Okay, so we wish we could have Laura here to chat all day long, but since we can't, we are gonna just wrap it up with some if there are any nightmare or embarrassing stories that you've ever experienced as a provider in this situation, Laura, and then we can share if we've ever had any nightmare embarrassing stories.
Yeah. I'm not, some of my stories are kind of just like things that make me laugh a little bit. It really is true that nothing like really surprises me. I've really heard it all. But probably something that still makes me laugh a little bit under my mask is when people use like vulgar terms in a medical office. That always, because some people it's like they're more comfortable even using like slang terms. Or sometimes people will refer to their vagina as she. Like, she's really itchy. Stuff like that. Just kind of like unique nomenclature people use.
Yeah, when people are like
At,
vagine or like my like
yeah,
whatever.
My lady area.
yeah. But those are funny. They kind of like lighten the mood a little bit sometimes. Of course, you can never laugh because you
Yeah.
never want patients to feel like you're laughing at them. That's when you have to have like a little bit of a poker face. But that tends to be the only thing that breaks my poker face is someone's like, my see you next Tuesday is really itchy today. I'm like,
Oh my
whoa.
god.
That would blow me away. I'd be like,
Yeah.
hello.
And then some, like, I don't, sometimes what blows my mind is stories that people come in telling me, like from a previous provider. Like recently, there was a patient we saw in the office who was there for like preconception counseling or like fertility counseling. And I guess she, was single and was planning to do like a sperm bank type situation. And she said that a gynecologist told her a baby should have a mother and a father. Like,
What?
you cannot insert yourself into people's family planning like
Yeah,
that.
like most intimate life choices,
Yeah.
like with
To be passing
judgment.
judgment, that's totally across the
Oh,
line.
Yeah, that's
yeah, that's
crazy.
crazy.
I feel like,
So,
yeah, what you want from your provider is like no opinion, really.
Right,
mhm.
you
You
want
want
support, you want
support.
facts.
Yes.
Yeah, medical care, whether that means like you're 20 and you're having a baby, or like you're 35 and you're preventing pregnancy, or you're in a same-sex relationship, like none of that goes into my like difference in my medical care. The family planning and people's social situations like should not influence how we provide care.
Yeah.
Right.
Oh, that's horrible. I'd be so pissed off.
Yeah.
Well, from my experience, I can talk about, I guess, like a horror story is a little bit of a strong term to use, but I've been lucky to have pretty good experiences with my like gynecology providers. But there was a time when I was in college and I showed up for my annual exam, and they had me filling out the forms of just like making sure all this info is correct. And then I got to the STD part and it was like already marked like has herpes. And I was like, what are you talking about? I don't have herpes. Like I was just so shocked because I was like, what is this? And then it kind of became this whole drama because then my providers also like weren't sure what was going on because they were like, we don't remember like why this is marked that you had this, versus like me being like, no, I don't. And basically it ended up being what Laura has mentioned previously, where I had gotten blood work done saying that I had been exposed to herpes, not that I had it, but in the moment it was like, you have this thing that you had no idea you had. I also was worried because I had started dating my boyfriend at the time and I had not told him that I had herpes because I
Because you
didn't
didn't know
know
that.
that, which ended up I did not have it, so I didn't have. If I had it though, like there are a lot of ways you can work with your provider, as we mentioned, to deal with that situation, but it was just very stressful. I remember this is when I had first started dating my boyfriend, and I literally was like, I can't talk to you for like 5 days, and I was like, I'm so stressed because I just didn't know what it meant at the time, and I didn't have any clear answers because I had to get tested again basically to confirm or deny whether or not I had it. And so I had to wait several days and it was very stressful.
Mhm.
So yeah, didn't love that, but
Yeah. Moral of the story: do not test for herpes in the blood. It benefits no one.
Major takeaway. Yeah.
also good to know, like, I don't know, maybe if your provider does want to test you for that, just ask maybe more questions of why that's necessary, or explain what your sexual history is and maybe decide whether or not that's really necessary. Just
Because Olivia, you
advocating.
don't even know like how for how long you were positive with that. That could have been like your aunt kissed you who had a cold sore at the time. And
Yeah.
now you're
Right.
always going to be
Right.
positive in your blood, and it's ruining your relationship, and you didn't talk to your boyfriend for 5 days
Yeah.
because your aunt kissed you. It is
I
just
had a
so
mental breakdown.
unnecessary. Yeah.
Yeah. And I think also too, like it was a little bit of a different time in my life. I was in college. I was dealing with a lot of other stressful factors and like the stigma that came along with being told that you had herpes. So I think that also contributed to my extreme stress. Like, once again, as Laura said, being told you have herpes is not a death sentence. I was kind of acting like it was. So that was like a little bit of a dramatic response on my part. But I think there is also just stress of being told that you have had something for a year, basically, that you had no idea that you had because no one ever told you. That was also the frustrating part. I'm like, you marked me as having this and no one ever contacted me to let me know
Right.
that I had this. So, anywho, I do have a different doctor now, but yeah, that's kind of the extent though of my horror stories. Luckily, I've been lucky to have a really good provider where I live in San Francisco now. I love her. I can like also message her, which is so nice.
Mhm. I know, I love these, like, online portals where I can get, like, all my results for things, like, I can message people. I'm like, "This is convenient."
Yeah, because another reason I needed to stop taking the pill for me personally was I was horrible at remembering to take it. And so it would lead to a lot of drama of me having a panic attack that I didn't have my pill, of me having to call or message my provider, having her prescribe me a new pill pack in like random cities that I was now in because I forgot my pill pack. It's just not for me. It is for other people. It's just I'm not I can't remember to take it.
Yeah, some people aren't good pill takers, and that's why there's a lot of options out there.
Yeah.
Laura, we are so grateful that you joined us today to talk about your profession and women's healthcare. And I feel like Olivia and I learned a lot.
We do. We love Laura.
We love Laura.
We
We
love
love her knowledge.
knowledge.
And we hope that you all learned a lot too. And if you would like to hear more from her in the future, let us know because we would love to have her back. We would also love to have her talk about the OB side of her job as well. We focus today more on the gynecological side. But let us know what you think. And thank you so much for joining us. And we'll catch you on the next one.
Yay, thanks so much for having me. This was so much fun.